conversation with Dr. Allen. We have some good information for you today, and I think that it's going to be useful for you and your family and whoever else. At this particular point, the SOS motto is what we need: save ourselves. It's very important that we share these videos because there's a lot of good information. Now, my first question that I'm going to ask is, outside of me, I want to see the hands of any other individual that you know that has immunity to the coronavirus. Outside of me. Remember, these videos are public, so we're hoping that we're going to share these videos. Outside of me, how many people do you know that actually has bona fide immunity? Bona fide immunity. Here's Eugene Allen against the coronavirus. Now, don't be shy. Don't be shy. It's important. Don't be shy. Your neighbor, whoever else next to it. But outside of me, do you know anyone else that has immunity to the coronavirus? Now, if you don't, that's a shame. If you don't know anybody outside of me in this entire world that has proven to you that they have immunity to COVID-19, that's a shame. And you should ask yourself, why is it a shame? Because no one is talking to us. Remember, SOS, save ourselves. Now, if you're sitting around and you honestly believe, I'm just waiting till the vaccine comes, or I'm just waiting until someone tells me what to do, and nothing is happening, you are absolutely wrong. If you were watching the tragedy that happened at Indonesia, and my heart and our heart goes out to those individuals. If you were watching what happened to little Bow Wow, and he had a concert in Atlanta because people are hungry, and I respect him for trying to get some money and live, you were being distracted. And the reason you're being distracted because while those other things are happening, teams are being designed. Vaccine teams are being designed to give you the COVID vaccine. Now, here's the funny part about how the process works. You don't know that, but in 2 to 3 weeks, they are going to be vaccinating you. I am fortunate to be called as one of the vaccinators in the mass vaccination of the population. Remember, the first set was from hospitals and big group. The second set is by invitation only. They control the way this vaccine is going to go, and they invite who they want to vaccinate you. I received a phone call, and the conversation went like this. Here, from the subject was vaccine provider. I cannot let you know these individuals' names, nor can I give you the site, but I can tell you the following. Greeting, Dr. Allen. It was a pleasure speaking to you this afternoon. As we spoke over the phone, I will be sending you a set of links that will help guide you on how to enroll to become a provider of the system. And this is the name of the system. It will be operational in 2 weeks, which means by the end of January, the 1st of February, the teams will already be selected for you to get vaccinated. This part is their control. Now, this is in Los Angeles. I don't know if you live in another place, but this is in Los Angeles. You will be sent to this link where I sign up at this link, where you as a patient will go to the link, register to come and get a vaccine. That's where you go. I will not, repeat, it will not be given to random doctors to be able to drive over to the rich neighborhoods and give them out like they want to. These vaccines will be controlled. The vaccine itself will be given to certain providers. Once you register you then will be sent to your area. Now keep in mind, I cover a large portion of Los Angeles, Inglewood, Cudahy, Southgate, Linwood, Montebello, Whittier, Bell, North Long Beach, Cerritos, and Linwood, and Downey. They will be able to register and come to Dust to Done and get the vaccine. That's how you get involved, and that's how they make sure that the vaccines are only given to the individuals that register, and the doctors don't just do whatever, and that's how they control it. The second one is this second link, where it said the second link is where I go, where I register with California Immunization, and then here would be where I will be given the training tools on how to keep the vaccine safe and administer the vaccine for you, to you. So if you sitting at home and you're believing that things are not happening, don't be surprised, because teams are being selected and people are chosen to give you the vaccine. Save ourselves. I'm fortunate to be one to be chosen, because at least I know that you're going to get the right vaccine, and at least I know it'll be kept at the right temperature. And at least I know for the individuals that choose to get the vaccine, because I will not withhold the vaccine from anyone, that I will be doing my best to help you. But I do want to ask you another question. Raise your hands. And again, this is your person that's next to you and beside you. And this is for my colleagues. If you would like at least one or two of those individuals who took the 2 shots to post that the vaccine worked. Now let me repeat that again. Raise your hand if you would like some of our colleagues or our friends who went out and took the 2 shots and showed us that they took the vaccine to at least come back and post that they had immunity like Dr. Allen, so you at least would know that the vaccine worked and not just be listening. How many people want to see our friends? Now, we're not being angry with you, because for sure, if you decide not to, I'll be vaccinating people. I will then ask people to, if they are willing, to allow me, after they get the 2 shots, to show the public that the vaccine is working. But since we don't have time for that, and in 3 weeks we're going to be vaccinated, the only avenue we have in the SOS campaign, Save Ourselves, is for our friends who've already taken the vaccine to get their blood drawn and post that the vaccine worked. Tell us something. At least tell us that it took 2 weeks and you don't have it, but at least let us know, because they are planning to vaccinate you. And trust me, the conversation, they're going to vaccinate our children. That's the plan. Now, I wish I was making this up. SOS, Save Ourselves, share these videos, let people know it's coming. Do not be thinking that you're sitting at home, because you're going to have 2 choices. 1, vaccinate, or 2, not vaccinate. That's how you're going to be dealing with COVID. That's the only way out. Those that choose not to vaccinate, there's going to be a plan that I'm going to lay out to help you survive if you get COVID. Those that choose to vaccinate, there's a plan with these lectures that I'm laying out to help you fight COVID, because I have proven that you can beat the disease and develop immunity. Now, part of the lecture, or part of the reason that we're getting vaccinated, is because we see our friends. Healthcare workers, which is phase 1. Now, I want to make sure you understand, healthcare workers who fall into the category of EMTs, paramedics, dialysis center, acute care hospitals, ER, those type guys, psych facilities, nursing homes or whatnot, cancer system centers, surgery centers, any doctor's office or urgent care are phase 1 individuals. Now, phase 1 individuals, we assume, are our professionals, our licensed professionals, our individuals who we believe to be extremely intelligent and know what they're doing. But if you're following the followers, West Virginia had a clinic just like the one you're in, West Virginia, where they gave 44 people, this is published December the 31st, just no less than about 2 weeks ago. 44 people in West Virginia went in following the followers and got an antibiotic treatment instead of Moderna. They got the antibiotic treatment Regeneron instead of Moderna. The antibiotic treatment, which was developed by Regeneron, the company, was designed to prevent the infection for COVID-19. These individuals went in, 44 people took the antibody treatment. Now, mind you, it went through a chain of custody where the health department had began giving the antibody as the injection to the adults. And remember, it was also given to people who were healthcare workers, and they wanted to get the elderly people because they were more quote unquote high risk. Now, following the followers, the health department gave the treatment to the Boone County, West Virginia. Now, I went to medical school in West Virginia, and I'm from Mississippi. We ain't that slow. At least we try not to be that slow. But the health department gives them the antibody treatment. They then take the antibody treatment, not the vaccine, and then gives it to the healthcare providers, doctors, nurses, and people who have medical degrees. Now, here's the catch. To get Regeneron, which is this particular thing is given, which is the antibody treatment, is given by IV infusion over at least 60 minutes. IV infusion over at least 60 minutes. Now tell me, as a healthcare professional, or just as a regular person, how you would consider a 1 hour IV to be the same as an injection for a vaccine. If you're not following what the next person followed, that the next person followed. You're not even thinking. You just went in there, well, this must be a different type of vaccine. So I'm gonna sit here for my hour and I have no idea because I'm following the followers. I'm just going to do what someone else is doing, and I have no clue or understanding why. So if they come to you with a big needle and try to inject you in your arm, you're not gonna know because you're following what someone else done. You need to know what you're doing and why you're doing it. The next thing, on January the 12th, just recently, doctor died after COVID vaccine is being investigated. The man took the shot, and supposedly, according to literature, now I want you to be very clear about where this came from. This actual information came from the New York Times. Now I'm gonna zoom in on the New York Times so you will understand this information came in from the New York Times, where they reported that the man died after getting a COVID vaccine. Now here's the question. Do you think they're gonna finally tell us after the investigation? Or are you gonna follow the followers who either lead you to take an injection that you don't know what it is and expect to get something better, or you're going to follow the followers who may actually have a bad outcome? These lectures, the SOS lectures, is to bring the information to you. The tree falls in the forest and don't make no noise. Trust me, it don't make a difference. But if the tree falls in the forest and we let as many people as we can know that, one, in 3 weeks they're going to be trying to vaccinate us and our children at about the end of January, and tell me I don't know. And two, if you're taking the vaccine because somebody else took the vaccine and you don't even understand the vaccine, you could get hurt. You have to know what you're doing because you won't have a chance to sit around. It's either vaccinate or not vaccinate. There is no in between or death. And they are dying completely like you wouldn't believe. Got a text message today about 3 people that passed in the hospital. My lecture is to teach you how to fight, not to tell you if we are against vaccine. That's not what's going on. Or to tell you to get vaccinated. It's to educate you on what you're missing. Now here's some other stuff that I think you should know. Number one, USA Today USA Today clearly lets you know that Medicare pays more money for anyone who is diagnosed with COVID-19 under the CARES Act. Doc, how much is that? If you come to the hospital and just get admitted, and this is still USA Today, a fact check and sources. If you get diagnosed in the hospital, diagnosed with COVID, it's $13,000 just to have the diagnosis. Now that's not counting the breathing treatments and the other medications and IV you need or the respiratory care. That's just for the diagnosis. If you get placed on a ventilator, it's $39,000. $39,000 just for the back, just for me to tell somebody in the hospital that you are COVID and put on a ventilator. Now we know they're gonna put you on a ventilator because you can't breathe. Now remember, my talks about how to help you stay away from the hospital, how to help you defeat the virus. My talks, or the SOS, Save Ourselves, is for us to share these videos and let people know what's coming down the pipe and not sit at home being quiet and assuming there's nothing's going on except for what the television is showing you. Here is the funny part about what you don't know on a financial level. LA County says that we have, LA County, there's an average of 6 people every minute that's passing away. COVID deaths every 6 minutes in LA County. California reports 695 deaths a day. So this is where we live, and I'm not sure the numbers of where you live. This is where we are in California. Again, you may be Mississippi or someone else I've been blessed to touch. Now, but you can't skip this one, which is the United States COVID update. The virus killed 4,000 people, and this is on January the 7th. January 7th, again, almost 10 days ago, it killed 4,000 people. Now, let me share something with you that you don't know. Number one, if there's one death every 6 minutes, and there's 60 minutes in the hour, then there's 10 deaths per hour. And if there's 24 hours in a day, then that's 250 deaths a day in LA County. And if there's 39,000, because you normally don't die unless you're on a ventilator, at 240 people dying a day, $9,360,000 a day in LA County. $9,360,000 a day in LA County. Now in California, there is 695 deaths a day. Remember I showed you California was 695 deaths a day. And if there's 695 people dying in the state of Los Angeles a day, you don't die unless you're on a ventilator, $27,105,000 a day in COVID deaths in California. USA Today said 4,000 people died on January the 7th. 4,000 deaths, again, you don't die unless you're on a ventilator, at $39,000. $156 million was spent on January the 7th for COVID deaths. It's either vaccinate, fight back with the beautiful thing that God gave me to help us, or die. And if you die, that's an issue. Because I'm going to tell you one thing. I was so afraid when I had COVID of the hospital. Now raise your hand. How many people are more afraid of the hospital than they are COVID? I'm definitely here to tell you. I was more afraid of getting COVID and going to the hospital than getting COVID and staying at home. Now I'm going to share a few other things with you. One, I've already told you that starting in 2 weeks, I got to go to this website and see how it works when you register to come get vaccinated. Now I'm going to say this from my heart. the Allen family will not be getting vaccinated. Now, I'll repeat that. The Allen family will not be getting vaccinated. Why? One is, I've proven to you that natural immunity can happen. I've proven to you that you can get the disease, and if you listen to the things that I'm telling you, you can fight back and survive. So if COVID comes back to me, I'm the only person that has shown you that you can beat the disease and move forward. I choose natural immunity. That's my reason for not getting vaccinated. Not that I'm against vaccination. I'm going to make sure that those individuals that want to get vaccinated, that I stand up for you. And you can already see the little kids out there making sure that the names are correct, and mom directing traffic, making sure people get the right vaccine and it's at the right temperature. You can see the Allen family standing forward at a time like this and then save ourselves, making sure that we do the best. But we choose the natural way. And I've demonstrated to you that the natural way will work. You just have to start programs early. But I am of no use to you if you don't share the videos and let each other know that vaccinations are coming, teams are being prepared, and you're either going to vaccinate or not vaccinate. There is no in between. And if you choose not to and you don't listen, you're going to be one of these numbers. One of those numbers, 156 million plus in the United States to help someone else. You need to share the videos, the SOS. Now, there's two types of vaccines. There's the Pfizer vaccine, and there's the Moderna COVID-19 vaccine. Now, for those of you who don't know, we will only be administering the Moderna vaccine from our local health department. I'm sure you didn't know that information. We will only be giving the Moderna to our population, period. Moderna is kept at temperatures, and we're going to come in and try to make sure, please, that you do see it, 25, minus 25, basically, let me just keep it in Fahrenheit. 13 degrees below or 5 degrees above. 13 degrees below or 5 degrees above. Now, here's something that you should know. If it freezes and you unthaw it, it's no good. If it goes over 5 degrees for more than 1 to 2 minutes, it's no good. You go somewhere and get a vaccine, you may get one that don't work. Because you might not know if it was thawed and frozen and rethawed and it was kept out of temperature. If it's not specific, it doesn't work. The second thing, Moderna. Again, here's the literature. Now, I can't make this up. Therefore, what I'm telling you is validated. Moderna is 94.1% effective in preventing COVID illness. Not 95, not 99. It's 94% effective. Now, notice they put the 0.1 in. Don't want to lose that. But 94% effective in preventing the coronavirus. Now, here's some literature that I thought might be helpful. If you have these conditions, your COVID vaccine may be less effective. Again, if you have these conditions, your COVID vaccine may be less effective. Now get this. Here's the condition. A new study conducted by the research at the Institute of Behavior Medicine says following, I'm going to summarize this, that reveals that both depression and stress could make the COVID vaccine less effective. Let me say that one more time. That both depression, now please make sure you see this, and stress could make the COVID vaccine less effective. Isn't that LA County? At least that's where I live. Isn't that most of all of us stressed and depressed with lack of jobs or having difficulty? So you're telling me that if I'm stressed or depressed, it may not work, And then you're telling me that if you don't keep it right and you give me the shot, it may not work. And it's already at 94% effectiveness. I'm gonna talk to my colleagues. You took the vaccine, post and show us if the vaccine worked. Help us. SOS, somebody help us. Save ourselves. You took the vaccine, they getting ready to give us the shots. Post that the thing worked. That's all we asking. I don't think that's a hard a question or a comment. We watching you like you watching us. 690-something people saw the last video. 10 people shared. How we gonna help somebody with that? You took the vaccine and we saw you. You look good. Come back with an immunity test and show us that it worked, because they getting ready to shoot these guys or vaccinate these guys, and I'm telling you the truth because I'm chosen to do it. SOS. Save ourselves. Help us help each other. You cannot just be laying around or you're going to be a number, and the choices are simple. Vaccinate, die, or natural immunity. And it's already a shame if I'm the only person that you know that can prove to you that they have immunity to the test. If you don't know anybody else but me, that's already a problem. Now lastly, this is January the 15th. January 15th, by the CDC, it says, what lasts longer? Immunity after getting COVID-19 or protection from the vaccine? Now, I have natural immunity, and all the studies are done on natural immunity. The individuals of myself, which we don't know anybody at this present time, probably but Dr. Allen. But they clearly telling you for the vaccine, we won't know how long the immunity is going to last after the vaccine until we get more data on how well the vaccine works with you. We don't know how long the vaccine is going to last until we get enough of us to take the vaccine so we can tell them what to do. Tell me, what about that don't sound experimental? We don't know. How many people, raise your hand, honestly thought we'll get 1 or 2 shots and go back and play some baseball with our children and go back to normality? Come on, 1 or 2 vaccines, I'm back to normal. Be at the nightclub. Hey! How many of you people thought that's going to happen? The current design is 1 to 2 shots every year, just like a flu shot. A lot of people think they're going to get 1 or 2 shots and they're going to be vaccinated. It doesn't work that way. And clearly, if you don't get this, I'm going to repeat, CDC. CDC, that's who controlling everything, updated on January the 15th, just so you are clear, and they wrote in plain English, we won't know how long immunity lasts after vaccinations until we have more data on how well COVID-19 vaccine works with you. But the funny part is experts are learning, but their experts are working to learn more about how it works on me. Experts are working to learn more about both natural immunity and the vaccinated-induced immunity. But we don't know how long or how many vaccines you're going to have or have to take before you get vaccinated. We don't know how many of us that are not stressed, how many of us that don't have some issues. Save ourselves. I can't help a soul unless you share the videos, put the information out. 3 weeks, we're going to be vaccinated. Yes, me and my family be out here trying to make a difference. But if you're going to get a vaccine, know why. If you choose the natural way, say, I choose the natural way, because that's the only proof I've had that I can catch COVID and get over it. I'm going to watch what Dr. Allen did, because somebody came to show me how to fight back. And if I choose to get vaccinated, then I didn't get vaccinated because I saw our presidents do it, or our vice president, or I saw the followers follow the followers. I chose it because I thought it was the right decision for me based on what I read. And I went and got the vaccine with the understanding of whatever side effects it was going to be. But make a decision on why, not because you're following someone else, because if you follow someone else, you may get hurt. Now, the lecture today is separate, but I'm asking again for immunity. And this is what immunity looks like, and if there's anyone that has had or been exposed, to please go in and show us by blood work that you have immunity. Anyone that comes down with the virus, that it is most important to see, did you develop immunity? As I can tell you, with immunity testing, they're going to take the and then once the blood comes, Teresa, you would then aspirate the blood. I will tell you, those individuals, one, two, and stick my own self. See it moving, and then boom, I kind of go into it, and see, am I in it now? There it is. And then Teresa now is going to connect it, and then she's going to aspirate. I will tell you, for those individuals who actually does get positive or come into a positive COVID test, that you should check for immunity. What I have learned and what I am learning is that it may... I've known Dr. Yu for 17 years. Now, the lecture today is about what we call Mama's Magic Pot. Mama's Magic Pot. Now, I'm going to talk to you about Mama's Magic Pot, but I'm going to tell you what made me think about Mama's Magic Pot. See, when I was stricken with COVID, it went straight to my lungs, and I could not breathe. I was struggling for air like you wouldn't believe, but I was too macho to say anything. So my wife says to me, and if you're married, you get this. She said, what do you think if I have someone to bring some O2, some oxygen from the office to the house? Now, if you're married, I'm going to tell you right now, your wife don't ask you what you think about anything. So if she says, what do you think about the neighbor's car? You need to be saying, okay, honey, when we going to go look at a car? Everybody that's married knows that if your wife asks you, what do you think about something, you need to be quiet and say, okay, let me see where this conversation is going. And number two, who she been talking to, because they trying to put me on oxygen. Now, I say exactly what I think any natural husband would say. Now, mind you, my oxygen saturation is 88. That's below 90. I said this. I said, honey, let me say, I don't think I want the neighbors to see the staff drop an oxygen tank off at the house because they know I have COVID. They're going to think that I'm really in bad shape. Now, just to show you that the wife is not even caring about what you think, she replied to me as sweet as pie. She said, oh, you don't have to worry about that. I've already spoken to George, and he's going to put it in a box and drop it off at the back door. So I'm like, wait a minute. Y'all going to put me on oxygen? Who you been talking to? Now, I'm going to show you something funny, but I've known my wife for quite a while. And I'm going to tell you something about my wife. I know my wife. We've done some great things together, and we've also traveled the world together. One of the most important things is she also knows me. In order to keep a guy like me, who's very aggressive and hardworking, you either got to be very smart or you have to be... So when she said, what do I think about oxygen? This is exactly what I thought. I'm going to be pushing this thing around the house, and I'm going to be trying to use the restroom because I can't breathe. And I think the next thing they're going to do, they're going to put an IV in me, and here I am watching all around the house with my oxygen tank. One that was running and a backup that was ready to go. That's exactly what I thought about her and her oxygen tank. So I'm going to tell you one important thing. That if that can motivate me to breathe, I learned quickly, I am going to start breathing. Now, mind you, my saturation was low, and the first thing that COVID does is go straight to your chest. COVID tries to choke you out. Now, I went to Mama's Magic Pot. which is my concoction, if you want to say, for deep breathing exercises. I was going to force myself to take some deep breath because I didn't want to be stuck at a saturation of 88, and I surely didn't want to be running around my house with an oxygen tank. Now, Mama's Magic Pot is natural ingredients. Mother Earth. 1 orange, 1 lemon, 1 garlic, 1 onion, some eucalyptus leaves, or if you don't have find the leaves, you do the oil. You put it in 5 cups of water. You then cut it up, bring it to a boil. Once you bring it to a boil, you take the lid off it, put the towel over your head, and you get the breathing. You get the breathing. Yes, it's going to hurt. Yes, it's difficult. But I was going from 88 saturation, struggling to catch my breath, and every time I finished the pot, I was at 98. Because I surely didn't want to be in the hospital, as I told you earlier, and I was scared to death of that. Now, here's the funny thing I'm going to tell you about this. One thing is, you don't have the access to the things that I have. Now, raise your hand, and I'm just going to keep saying it, if you can appreciate a bologna sandwich and some cheese. Now, help me, if you put some jelly on it, it's a delicacy. Raise your hand if you know when you go to Louis Vuitton that you expect them to follow you around when you're shopping for the purse. Now, I'm going to tell you something real quick. I remember the first time I went to buy my wife a Louis Vuitton purse over what they call Century City, which is right by Beverly Hills. Now, when you go to this Louis Vuitton, they don't have security, they have bodyguards. I remember clearly that the guy was 6'6", standing at the front door. Now, they had just dropped off the young Japanese tourists, and the ladies was in there busy. So I'm walking around looking for the reasonable purses, because if you've been to Louis Vuitton, they didn't have the budget purse that I have. I'm looking for the budget. And I remember the 6-foot guy following me around the store. Now, mind you, he finally got the courage to walk over and say, "May I help you?" So I'm looking at him like, okay, this is a 6'6" brother. He started talking to me about if this way he has to get a tall purse because he's taller and the strap not to be longer. And then he want to show me some other section where they had the secret pocket in the back of the Louis Vuitton purse. I was like, man, you get away. This don't work for me. But that's what you expect. This is the you that I'm talking about. That's the population that I'm trying to get the message to. That's the individuals that understand one thing. I had to suffer for you. I realized one important thing. I love you more than what you know. Because at any point during the struggle, I could have got Regeneron, or I could have had all of these fancy things. But just like Christ, now I have to give that, Christ is the ultimate credit. Because it's only through suffering that I can come back and tell you what worked. It's only through suffering that I can come back and show you what happened. It was only through what God sent me through that I can come back and tell you how to fight back. Death, vaccinate, or natural. There is no in between. SOS, save ourselves, and you're not going to get information. It's got to come from us. Now let me tell you a few things about Mama's Magic Pot.
During every person's strive of recovery, we always think about or ask for our mom to help us. So to your left are the actual ingredients that I chopped up for Mama's Magic Pot. I then put it in the pot, as you will see here, where it's now have been cooked and brought to a boil, and there's the steam.
Put a towel on my head and try to inhale this as much as possible. As you can see, hopefully we can see the garlic, lemon, onions, oranges, and all the things inside. Let's see how this works. All right, here I go.
secret to Mama's magic pot was my saturation was 88. I did those deep breathing 3 to 5 times a day, inhaling, and at the end of the day, it was so good, the house smelled so great that my wife had to get on the magic pot.
Now, deep breathing exercise. You actually got to get in there and tell yourself, I'm not going to the hospital. I'm not going to be on oxygen. You don't have access to steroids. You don't have access to incentive spirometry. But you do have the natural things that Mother Earth gave us. Because see, the funny part about it is when COVID hit me, it went boom. And at this particular point, I was in denial. I was like, this can't be true. Then all of a sudden it hits me and I go, boom. Boy, did I jump back up. Oh, yeah. Now, this is a reenactment of what was happening, but you can't tell me I wasn't ready to fight. Because you got the wrong one if you're trying to take me out, my brother. You got the wrong one. So COVID hits me again. I go down on one knee. I get back up again. I'm ready. He hits me again. Boom! Oh! And I get back up. I'm trying to get back up, and I'm doing my best. But all of a sudden, a couple of days down, my homeboy starting to show up. My homeboy starting to show up. And oh, my homeboy starting to show up. Now I'm like starting to get my strength back. Oh God, yeah. My energy, about the 4th day into it, I can smell a little bit. I'm getting my appetite back. I want to eat. My strength's down. Immunity shows up. My little man, I got you, Aaron showed up. IGA had already showed up. And then IGG, my big man, is showing up. He's saying, I'm good, man. I'm not going to let you get down. And now the prayer angels, all those people that prayed for me, Father, start coming in. All the people that was really lifting and said, God, don't let him take him out. We need him to help us and help others. All the prayers start coming in. And lo and behold, about the 7th day into it, I know God is good showed up. IGG, my immunity team had came back, and now we was ready to fight. And trust me, when the fight started, it went a little bit like this. Woo! I was trying to swing with my left, swing with my right. I know God is good. And I know that's the only thing that could have stopped me and could have helped me when I needed and when I was down. So I'm telling you, I'm no good to anyone unless you share the videos. Mama Magic Pot is all I needed. Not the hospital, not my O2, and not the prednisone. Just the will to live. I tell my employees, I'm like roaches. Roaches is the only thing that'll withstand an atomic bomb. It's the year of the underdog. The time now, the people that were struggling to make it, the people that can appreciate the bologna sandwiches. But the only way we're going to survive
is to help each other. SOS, save ourselves. I make these lectures entertaining, but I pack them full of knowledge so we can help each other. Co-workers, test. Sure as we're going to have some immunity and that those shots work, because they're going to be giving them vaccines out. If you live in my area, I'm going to try to make sure it's okay. So if you choose to get the vaccine, at least I'm going to do my best to make sure you're okay. And for those individuals who say, no, I refuse to get vaccinated, know why? Because I know for a fact that you can receive natural immunity. Take COVID, follow Dr. Allen rules, and get natural immunity. Just know what you're doing. It's either vaccinate, not vaccinate, or die. Thanks for watching Conversation with Dr. Allen.